3 months ago, I had no idea what veterinary medicine was. I had done a variety of research and knew it may be something that I wanted to pursue, but I didn't realize the extent of what it was until I started mentoring under Dr. Hunter. It's not just playing with animals all day, but forming an animal-human bond and providing an animal with a healthy and prosperous life. I've already learned so much about the veterinary field and how it may fit into my future. My name is Alexis OW, and I'm a junior at Frisco High School. I'm a committee chair for the E&E branch of Student Council, as well as being involved in National Honor Society and National Technical Honor Society. Since I was little, I've always known that I wanted to do something with animals, but I always struggled with the negative aspects, such as seeing animals suffer and seeing animals be put down. But in the past, I volunteered at the SPCA in McKinney, and I've seen spays and neuters and got to see more surgeries. And then I've also had a variety of animals in the past, from lizards to hermit crabs. And then currently I have 2 dogs, a Cocker Spaniel and a Dachshund Terrier mix, 2 cats, 2 fish, and a parakeet. So a large part of the information I've learned so far in the ISM program has been through interviews. My first interview was with Dr. Jillian Hunter from Lazy Paws Animal Hospital. She's familiar with the ISM program, and she's been involved for the past few years, as well as being involved in the CTE Center Vet Med program. In my interview, we discussed career expectations of a veterinarian, such as their daily job duties. They do paperwork, examinations, surgeries, just overall stuff like that. And then we also discussed one of the biggest challenges veterinarians face, which are client expectations. And I brought up a excerpt that she had on her LinkedIn page over the America's Favorite Veterinarian contest, where an incident of cyberbullying occurred, and the results were inconclusive because people were attacking the veterinarians' reputations and threatening their lives. So she was really frustrated with that and how clients often don't understand the pressures that veterinarians are under. My second interview was with Dr. Casey Cole from a Healthy Paws Veterinary Center. She mentioned that veterinarians often have a high suicide rate due to a symptom called compassion fatigue. So pretty much veterinarians often take the emotions of their work home with them, and if they've had a bad day or they had an animal pass away during surgery, it could lead to depression, especially if they already have a personality susceptible to that. It could be really detrimental. And then we also talked about some of the strangest cases that she's had personally, and one of them was a Great Dane that came in and its diaphragm had collapsed, so all of its internal organs were moving up into its chest cavity. And then another one was a pit bull that had swallowed 8 squishy toys that she had to go in and surgically remove. And on the x-ray, they originally thought it was only 2 or 3, but when they went in, it turned out being 8. And then lastly, she'd recently done a surgery on a Chihuahua with pyometra. And pyometra is severe inflammation of the uterus. So when they took the uterus out, the Chihuahua weighed 2 pounds less. And she showed me a picture on her phone where the dog was open on the operating table, and they had the uterus laying on top of its abdomen. It was pretty much the size of the dog. My third interview was with Dr. Schultz from Maisie's Mission. And this interview was a little different from the other ones I'd done because she worked at a nonprofit organization rather than in a private practice. And she told me the inspiration for starting Maisie's Mission was her dog Maisie, who had had a lot of health problems and had eventually had to have her 2 front legs amputated. And so she named the foundation after her. And then she discussed the reason she left private practice and moved on to nonprofit organization. And it was mainly just policy-wise. Within the private practice, she felt like they were treating more the clients rather than the patients, and they would euthanize the animals because the situation would be inconvenient for the people. They wanted to go on trips, or they just didn't want to deal with the animal, so they would euthanize the animal. So she moved to nonprofit in order to better serve the animals, and she specifically works with rescue dogs and cats. And she has a specialist come in to do orthopedic surgery, so she sees a wide variety of that. My fourth interview was with Dr. Lindsay West from the McKinney Animal Hospital. And we talked about some of the strangest animals she's dealt with. And through her internship, she was an extern at the Fort Worth Zoo. and she recalled doing dentals on alligators and restraining kangaroos for vaccination, sedating lions, working with gorillas on like behavioral issues. And I just found that really interesting how she worked with small animal, but she was still able to see all these experiences and get to work with these different animals during her education. And then lastly, we talked about client expectations. And that was like a common frustration I heard among the vets, but she said one thing that really interested me. And it was that when compared to doctors, veterinarians are often respected less, but they expect more from them. So they expect results immediately. They want to hear answers right away, despite the fact that they might not expect the same thing from a general practitioner. My last interview was with Dr. Larry Montz from the Animal Hospital of Frisco. And while I was on my interview, a dog actually came in and she had torn her third eyelid. So the third eyelid rests right below the lower lid and it swipes up to help protect the eye. So she must have like scratched something and it had torn. So during my interview, he let me watch as the vet techs restrained the dog and he clipped it. But he said it had done exactly what it was supposed to do, and if it had not been there, the cornea would have been scratched and the dog would have required much more extensive surgery. And then we also talked about like the education necessary to be a vet, which includes 4 years of undergrad as well as 4 years of vet school, and then often they go into an internship before starting their career. And the large amount of debt that comes with education can be intimidating. So also along with interviews, I conducted a lot of research about the veterinary field. My first research assessment was about blood donation in animals, and prior to researching this, I hadn't really thought about an animal needing a blood donation or transfusion during surgery, but similar to humans, they do. Contrary to popular belief, it's actually harmless to the donor animal if it's done just every once in a while. And these blood transfusions are helpful if there's significant blood loss during surgeries, or if like a dog's hit by a car, there's a medical emergency, or with other serious health problems. And I learned there's actually different blood types between canines and felines and within each group. My second research assessment was how 3D printing has led to the development of prosthetic limbs in animals. So if you've seen the movie Dolphin Tale by Disney, it's similar to that, how they've designed like limbs that help the animal continue to function with everyday life. So some of the things that the article included was a dog with deformed front paws received front legs similar to the legs of a rocking chair, which helped it like glide across the floor so he could walk again. There was an example of a cow that had gotten its leg tangled in barbed wire and the circulation had been cut off. So after having his hoof amputated, they produced a prosthetic hoof, which I thought was really interesting that something generated in a 3D printer could support an animal that weighs hundreds of pounds. And then lastly, there was a tortoise that had an abnormal shell that was like bumpy and rigid, and it would be prone to infection with like the other turtles crawling over her. So she received a shell that would fit over her current shell. They attached with Velcro. And there's a picture of the tortoise's shell and the red prosthetic part they put over her original shell. My third research assessment was how dogs process human faces in specialized brain areas. The area is called DFA, or the dog face area. So they trained these dogs to sit in MRI so they could scan the brain activity while looking at these 2D images. And what they found out was when they see human faces, they recognize it with like joy, like if they were getting treats, or they just get like really excited rather than if they had just seen like another animal's face. But I thought it was really interesting that these dogs were trained against their primal instincts because their general attention span is 15 minutes, but an MRI can last up to 45 minutes. So these dogs are trained to go against their instincts, where this is like a common struggle among humans going through MRIs. My fourth research assessment was over canine hydrotherapy, and it's a rehabilitation option that's growing in popularity because it's showed to be very successful. And it helps the animal build up muscle tone without adding stress to the already damaged muscle or tendon. So pretty much just as like when you're in water, it helps you feel weightless, so the dog's able to move and exercise without putting the extra pressure or stress and causing more damage. So there's a video. I don't know. Flame it. So you can see it's just like a treadmill at the bottom of the tank, and the dog just walks along it, and it just helps him get his exercise and work the muscles that were already strained without putting too much damage or hurting it further. Thank you. My fifth research assessment was over the use of adult stem cells in a kidney transplant for a cat. So the cat's name was Arthur, and he needed a kidney transplant after being in chronic renal failure, but his body was unable to properly absorb cyclosporine, which would make the donor organ be rejected if the surgery was performed traditionally. So his owners took him to the University of Georgia's veterinary teaching hospital, and they harvested cells from the cat to grow personal stem cells, which would allow the donor organ to, I guess, be successful within his body. So after the surgery, both cats came out happy and healthy, and so the owners of the receiving cat were required to adopt the donor cat, which I thought was good because both cats would then get good care. So after conducting all this research, I went to choosing my mentor, and I chose Dr. Jelaine Hunter. She is the owner and veterinarian at Lazy Paws Animal Hospital. She has more than 14 years of experience as a veterinarian, and she's been involved with the ISM program for 5 years. Overall, I just knew that she was the right choice because she'd be able to give me the best opportunities and be able to teach me the most about this field. Although I've only gone on a few mentor visits, I've already seen a lot. I've seen multiple dentals on both large and small dogs, and seen how maneuvering around the mouth is different based on the size. And there's a picture of like before dental and after. You can see like how it's cleaned up and how the gums aren't as inflamed. I've seen multiple mass removals under anesthesia where she's gone in and cut off like fatty tumors or just excess masses. And then on my last mentor visit, I saw a cat that came in for a checkup after he had previously had a corneal ulcer, and his eyes were just really swollen and goopy, so she used this fluorescent eye drops and put them in, and once you turned off the lights, the parts of the eyes that were damaged would glow bright green. So that was really interesting. And then one of the things we see a lot that really frustrates Dr. Hunter is obesity among the animals, because the owners are feeding them too much or not allowing the animals to get regular exercise. And she gets really frustrated with this because it puts the animal's life at risk just for a simple mistake. And then I've also seen them trying to extract a urine sample from a cat, and they actually just stuck a needle through the skin and through the bladder wall to try to extract it straight from the bladder. So after seeing all that, I'm looking forward to seeing more surgeries and examinations and just learning more about the field and gaining the hands-on experience. Okay, so for my original work, I decided to focus more on the business aspect of the field. While I was going on my interviews, I heard among all the vets that the biggest challenge was client financial restrictions and how they would often have to end treatment or euthanize an animal because the owner could no longer pay for treatment. And so I decided to create a business plan with extended payment plan options that would hopefully help avoid unnecessary euthanasias. And while I was researching this, I saw an article on a vet who offers pro bono surgeries to low-income or homeless people whose animals would have no way of getting veterinary care otherwise. So I also tried to incorporate a way of budgeting in pro bono surgeries. So prior to creating my business plan, I put in hours of research. I researched current payment plan options within the field, which mainly consisted of cash, credit cards like Care Credit, Nationwide, Pet Plan. And one of the things I saw was a comparison between all of like the current options and like the disadvantages, pros and cons, including like the need to apply for Care Credit and like the high interest rates that often come along with the insurance plans. When I was building my business plan, I started off evaluating the current market and assessing everything that's going on. I then identified the purpose of my plan and the benefits it would hopefully bring to my clients and patients that it would affect. I then identified the major competitors, which were obviously the already established companies such as Care Credit, Nationwide, Pet Plan. I then laid out my pricing and policies. So my plan would offer a 3-month, 6-month, 12-month, or 24-month payment plan. And interest rates would depend on the individual plan, but would be comparable to a credit card because the loan was unsecured. And then there'd also be a financial background check prior to initiating a plan to make sure that the client was dependable. The information about the plan would be distributed through brochures, advertising, as well as just promotion throughout participating veterinary clinics. And then if the plan ended up being successful, I laid out an extended plan where in the future veterinary clinics could get together with investment brokers and set up kind of like a fund where the client could invest money, and if the money was needed while the animal was young, it would be used for treatment, but if it wasn't needed, it would continue to build interest and could be used when the animal gets older, as well as being able to be transferable among the pets that the family may own. So overall, after completing my original work, I realized how important the business aspect is within the veterinary profession, especially if I were to ever run my own practice or be involved in the business aspect. And I also realized the difficulty in creating a business plan with assessing all the possible scenarios and crunching numbers, looking at all the prices. And I realized how much more strenuous it would be if you were really running a company, because you'd have to take in revenue and supply costs, so it'd just be a lot of numbers and work. And then lastly, I recognized the value my business plan could bring to society. Even if it only affected one patient or one client, it would help to remove one more unnecessary euthanasia, so it would ultimately do what it was made to do. And then lastly, I'd like to share my quote with you. Success is no accident. It's hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you're doing. So I found this quote really inspiring, especially in today's society, because I feel like a lot of people just expect what they want to be handed to them without putting in the work or without sacrificing or studying. And so pretty much this is what I'm in the ISM program for, is to put in the work and see if this passion is something I'd like to pursue in the future and what I'd like to do with the rest of my life. Thank you. I might have gone, I was talking kind of fast.